everyone, this is Dr. Cara here, a Black queer doctor. And today I want to talk to you about something that hits close to home to many in our community, and that is cervical cancer. Now, January marks Cervical Cancer Awareness Month, which is the reason why I wanted to discuss it. So cervical cancer is preventable, yet it remains one of the leading causes of cancer in women globally. Here's the thing though, it's not just a concern for straight cisgender women. This conversation is for everyone, especially those often overlooked. Lesbian, non-binary, trans men, and definitely Black women. Now, we know that Black women are disproportionately affected by cervical cancer, but what about sexual orientation and gender identity? There's this misconception that lesbian, non-binary, trans men, individuals don't need cervical cancer screening, and that is an absolute myth that I want to debunk. Cervical cancer is caused by the human papillomavirus, or HPV. HPV is spread through skin-to-skin contact, not just penetrative sex. So this means that anyone with the cervix, regardless of who they are intimate with, is at risk. So the pap smear, by the way, is not a women's test. It's not just a women's test. It's a health screening for anyone with a cervix. Let me repeat that. Anyone with a cervix. So we need to make sure that our healthcare reflects our diverse identities. It's about taking control of our health narrative. Now, I've heard from many of my patients, especially those who identify as lesbian, non-binary, trans, that they've been told that they don't need to be screened. And that's completely false. Regular screening can either prevent cancer or find it early when it is most treatable. And when do you need to be screened? It starts at 21, generally ends at the age of 65, but definitely discuss this with your primary doctor or OBGYN. Now, there are unique challenges we face. For Black people, there's distrust in the medical system due to historical and ongoing racism. For us queer folks, there's often a lack of understanding or even downright hostility. But don't let these excuses deter you from having a healthy lifestyle. So this is what you can do. Find a healthcare provider that is your ally, not your adversary. Find or create safe spaces when you feel heard, where you feel heard and respected. And definitely ask about the HPV vaccine, which can prevent most cervical cancers. The vaccine is recommended for most teens and young adults until the age of about 26. Now, anyone over the age of 26 should discuss with their healthcare provider if the HPV vaccine is right for you, since many of us have likely been exposed to the virus after the age of 26. As a Black queer doctor, I've seen the power of awareness, of education, and of advocacy. I've sat with patients who've been scared, unsure, or even angry about the healthcare system. But together we can change this narrative, and we have to for our future selves. Cervical cancer awareness isn't just about prevention. It's about empowerment also. It's about ensuring that everyone, regardless of race, sexual orientation, or gender identity, has the information and care they need. So this month of January, let's commit to a couple things. 1, educating ourselves and others. 2, encouraging screening and vaccinations. And 3, breaking down barriers to healthcare for all. Remember, your health is your story and every chapter matters. So let's write this one together towards a healthier future. Thank you for joining me today, and stay informed, stay proactive, and most importantly, stay healthy. Until next time, this is Dr. Cara. Bye.